Week 2 of the NFL season brought us a lot of injuries. Let's talk about them. Welcome to That's Gotta Hurt. I'm Dr. David Geier. I'm going to try to get through, we're not going to do 16, 17 minutes like we did last week. I want to do the top 5 injuries worth talking about this week in less than 5 minutes. And let's start with Arian Foster, the Miami Dolphins running back. Injured his groin Sunday in the Week 2 battle, was immediately taken out of the game by the team's medical staff, and somewhat surprisingly was almost instantly pulled out, labeled out, not going to return. Now, in the days since then, the team is saying it's cautiously optimistic about Foster being able to play on Sunday. Now, it makes sense with a soft tissue injury like the groin is, with the adductor muscles on the inside of the thigh, that it would be day to day. You give him treatments, you basically see how he's responding in terms of pain, but it can be tricky to know when an athlete has completely healed. The risk you run with these soft tissue injuries, trying to get somebody back too soon, is that they re-aggravate it and set themselves all the way back to the beginning, and then you start that healing process over again. Add that to the fact that Arian Foster's had a lot of soft tissue injuries over his career, calf and hamstring strains and things like that. Not real quick to recover. I would bet that even if he plays, he's not 100% this week. Jay Cutler, the Chicago Bears quarterback, much maligned Chicago Bears quarterback, injured, or at least re-aggravated an injury to the thumb in his throwing hand in the Week 2 loss against the Philadelphia Eagles. Now, according to Adam Johns of the Chicago Sun-Times, he may have actually suffered that injury in Week 1 against the Houston Texans. Now, reports have come out, and I think I saw this with Ian Rappaport of the NFL Network, that studies have basically shows that he has ligament damage in his thumb. And they're saying, people are speculating 2 to 3 weeks. Head coach John Fox is saying he doesn't need surgery. There are other reports suggesting that the team's looking into that. What I suspect is happening is that he's injured the ligament on the inside of the base of his thumb, the ulnar collateral ligament. Basically, it's injured when the thumb's pulled away from the other fingers. Very often, that actually does need surgery to get it to heal, or at a minimum, you put the athlete in a cast to let that ligament heal. Generally, that can be 2 to 3 weeks, sometimes 3, 4, sometimes 6 to 8 weeks. Quicker if you're not an athlete that uses your hand. So if you're a linebacker, defensive back, offensive lineman, maybe you play in a padded cast. But for a quarterback that needs grip strength to throw the ball, I don't expect him to be back anytime soon. All right, one we talked about last week, that's New England Patriots tight end Rob Gronkowski. As you know, didn't play in Week 1, didn't play in Week 2 with a hamstring strain. Will he be ready to play in the Thursday night game this week against the Houston Texans? According to reports, Gronkowski says he feels decent and that it would be a game time decision over the process of the week with the coaches and the athletics trainers and the other medical staff, and it would be a group decision. Generally, that's true. That's how it goes, and you limit practice, gradually work people back into it. Here would be my concern with these injuries, like Arian Foster, these soft tissue injuries. If you re-aggravate it, you set somebody all the way back, and then you're talking about, maybe 3, 4 weeks, 6, 8 weeks. I bet the Patriots don't take a chance. Playing on Thursday night, they've got now roughly 10 days after that game. So if he doesn't play, you get another 10 days. Then potentially he'd be ready for Week 4. Ameer Abdullah, Detroit Lions running back and former Nebraska running back star. I'm a Nebraska fan from my days of living there when I was a kid. But Abdullah was injured in Week 2 and suffered a foot injury. Now, according to reports, his x-rays are negative, but I don't know that that's necessarily a good thing. He was seen after the game Sunday walking in a walking boot. Now reports are coming out that he's getting a second opinion with Dr. Bob Anderson in Charlotte. He's sort of a sports medicine foot and ankle guru. That's who you send people to if you have a worrisome foot and ankle injury in an elite athlete. That suggests that albeit x-rays are negative, there potentially is something more going on. Reports are foot strain. I think the concern would be an injury to the midfoot, and that's really right over the arch of the foot. And when you hear that area, you hear foot sprain, but somebody's really struggling, you think Liz Frank injury, which is ligaments that hold the bones of the midfoot together, or maybe a stress fracture. I would keep an eye on Liz Frank injury, quite honestly. That can be something that if it's non-displaced, you basically put somebody in a boot, maybe it heals 2, 3 weeks, maybe 4 weeks. Some of those need surgery, especially in elite athletes, and we've seen some running backs get that over the last few years, and that can be more like 6 to 8 weeks. And last, from the world of Major League Baseball, New York Mets starting pitcher Jacob deGrom will undergo surgery later this week on his elbow. Now, he's been out basically since September 2nd with inflammation of his forearm. Apparently had an MRI that was read as structurally okay, no structural damage, which that's usually good because what you're looking for is the ulnar collateral ligament. That's the ligament on the inside of your elbow that we reconstruct with Tommy John surgery. But now it comes out that he actually is having surgery on his ulnar nerve. This is the nerve that runs right along the inside of the elbow. When you hit your elbow and you have a sharp lightning-like sensation and numbness and tingling in your fingers, that's hitting your ulnar nerve. We call it the funny bone because you think it's hitting that bone right there, but you're actually hitting the nerve when you do that. Well, that nerve can be compressed with the throwing motion and chronic stress on that nerve on the inside of the elbow. You see it sometimes in athletes that do get Tommy John surgery will do a release of that nerve at the same time, but you can just have issues with that nerve on the front end. It causes numbness and tingling in the fourth and fifth fingers, forearm, and pain on the inside of your hand can be really aggravating. Sometimes you can just go in surgically and release the nerve. Sometimes you do what it sounds like the doctors at Hospital for Special Surgery in New York are going to do for deGrom, which is basically move that nerve in front of that bony process on the inside of the elbow. Fortunately, that surgery has a good success rate. Takes 6-8 weeks, sometimes longer to get better, so I wouldn't expect to see him much the rest of the season, but shouldn't cause any long-term problems if that's the only source of the problem. Now, the question will be if there's any long-standing nerve damage, that can take some time to get better, but I think all in all, that's actually a pretty good diagnosis, certainly better than hearing that deGrom was going to need Tommy John surgery. So Mets fans, I know you're disappointed now, but I bet that's actually good news when you head into next season. Okay, that's going to wrap up our 5 and 5 series this week in injuries. I hope you enjoyed the show. Thank you for watching. That's Gotta Hurt with Dr. David Geier. Tomorrow we're going to do something a little more fun. As always, I tell you, if there's athletes or injuries that you want me to discuss, leave them in the comments below this show. Please subscribe. Click the box in the upper right side of the page. Subscribe to this channel if you want daily episodes of That's Gotta Hurt with Dr. David Geier sent directly to you. Thank you so much for watching, and I look forward to seeing you right here next time.